I'm Dr. Cynthia.
And I'm Dr. Lisa.
And we're going to show you 3 techniques for pregnant women to help soften the pelvic area, decrease torque, and make room in the pelvis for labor and delivery.
Perfect. Now, mamas, this is your first homework piece that we want you to work on. So make sure that as you are doing these, always have a partner or helper nearby. Everything we're going to show you is just safer to have someone standing by, but they can also come in handy and do a lot of good as well.
Okay, so the first one is called inversion, and we're looking at full inversion as opposed to partial inversion. So at any point in any of these, if you have any dizziness or nausea, stop. Okay, we're going to start with a full inversion technique, and that's where mama goes into full versus in some techniques you do partial inversion, and that helps use gravity, the full effects of gravity to help baby invert. Okay, so mama comes on the couch in a high knee position and then goes down on the floor, and her partner can help her, or she can have a stool to help, or a chair. And she goes down fully on her elbows, tuck your chin, tuck your pelvis. Good. And so this is the angle that we're looking for here, and she can stay in this position for 30 seconds. So mama's in this position, keeping her chin tucked and her pelvis tucked, and just think about baby being in the same position to maximize the space. And when mom comes up, the partner should help because you can be a little bit lightheaded. Up to the full knee position. Okay, now we're going to do side lying position, and you definitely need a partner for this one. So we're going to have mama go on her side and scooch as close to the edge with her whole body as she can without falling over. And then her partner will come up against the baby and hold on the pelvis here, and then also making sure that the back is straight up and down and there's no torque or torsion. And then the bottom leg is straight, and then mama brings her top leg over and continue. Okay, so once mama goes leg over, the pelvis is going to try to go forward. So partner needs to make sure, again, that everything is nice and straight in the back. And then you can hold that until the mama feels a relaxation in the pelvis and hips.
And what we're going to do is the same thing on the other side. So whether you can flip over like this, or you have help coming up, and switch to the other side and do the same. Now, while this one is really important to help relax the lower uterus, again, getting baby ready in the best position as possible, there are a couple of warnings. If you've got severe low back pain, do not do this one until that subsides. You may not be able to get up. The other situation that you want to stay away from this stretch is for mamas who have extreme ligament laxity, in the cases such as Ehlers-Danlos syndrome, or a lot of extra fibrin and collagen in their ligaments and tissues. That paired with relaxin can create some hip issues for this type of stretch.
Okay, this is called a standing pelvic release. And again, this is going to help create space in the lower pelvis for baby. So we want mama to stand a couple feet from the wall and then put her arms on the walls, bent elbows, and stand there. So then your partner, the hand goes here in the back, right on the pelvis, and the other hand goes right under the baby belly. And then you just ask mama to do figure eights with your pelvis. And you just follow along, applying just a little bit of pressure between your hands. And if mom feels like any desire to move any other way, that's fine too. Okay, so this technique also helps to release the respiratory diaphragm, which can help with heartburn and
More pregnancy pain.
More pregnancy pain.
So, all right. So ladies, work on doing these. Like Dr. Cynthia mentioned, a couple times each day, and that's going to really help what we're doing in office with you and getting the hips and the biomechanics right for having that amazing labor and delivery.